Hi, my name is Julie Rondeau and I'm a nurse practitioner student with Athabasca University. And I'm presenting a fictitious patient today for my nursing course 518. Mr. B is a 45-year-old Caucasian male. He comes into the clinic today with complaints of lower back pain with pain radiating down into his legs bilaterally that has been happening for the last 7 days. He is now seeking medical attention because it is affecting his activities of daily living, as well as he was not able to go to work due to the pain. Mr. B appears to be in good health, and he is an active person that goes for walks or runs 4 to 5 times every week. His job is physically demanding, and he is required to be on his feet most of the day. When the symptoms started 7 days ago, he was out for a run in the park. The pain started in his lower back, and he noticed some tingling in his legs as well as a little bit of weakness. He denies any falls or any mechanical injuries. Over those last 7 days, Mr. B has been unable to go to work, he has been unable to run, and he has had difficulty moving around as he regularly would have. His pain to his lower back radiates into his buttocks, his posterior thighs, posterior calves, as well as into his plantar feet bilaterally. He says that the pain is constant and that he would describe it as sharp or dull depending on what he is doing at the time. He states there is some tingling and numbness noted in his legs bilaterally. The pain is aggravated by moving around a lot or by sitting for too long. The pain is alleviated by changing positions more frequently throughout the day and by bending forward while he walks. He has tried icing with some benefit. He has taken acetaminophen and ibuprofen with some benefit for the pain relief. He has tried bed rest but found little benefit for his back pain. His pain ranges from 4 to 8 out of 10 throughout the day, with it being worse in the morning after he's been in bed all night. His risk factors for having lower back pain is physically demanding work environment. He denies any family history of lower back pain. He has no incontinence, no sexual dysfunction, no progressive weakness, and no recent travel history. This is the first time he has sought medical attention for this condition. He is currently on pantoprazole 40 milligrams PO daily for esophagitis. He has no known allergies. His past medical history is a humerus fracture at the age of 15 and a cholecystectomy at the age of 35. He was diagnosed with his esophagitis 4 months prior to this clinic visit and is still on the treatment for that. He's married with 2 children, aged 15 and 17, and they both still live at home. He has good family support. He enjoys his work and he does work full-time. He does state that he drinks 4 to 5 beers every week, but he denies any substance abuse or smoking history. His vital signs were stable on examination, and his BMI is about 25.9. For his general appearance, he does appear well-groomed, and he is dressed appropriately for the weather. Mr. B is alert and orientated and does not appear to be in any distress. When he does move around due to the pain, he sometimes does have some facial grimacing. He does move slowly due to the pain. However, his gait is normal and he has no involuntary movements noted. His interspinous spaces L5 and S1 are tender on palpation. Thoracic and lumbar ROM is normal, and the ROM against strength is a grade of 5. He had a straight leg test positive and a Valsalva maneuver positive. He had hip and knee ROM bilaterally is normal with a strength of 5. He does have a little bit of weakness noted in his plantar flexion of the feet bilaterally with a strength of grade of 4. Otherwise, his dorsal flexion is a strength of 5. He does have some sensory loss noted to the posterior calf and plantar aspect of the feet bilaterally. His Achilles tendon reflex is a grade of 0. Heel to shin test bilaterally is normal. So in summary, Mr. B presented with a lower back pain with radiating to the legs bilaterally. He has a positive straight leg test, a positive Valsalva maneuver test, with a strength of 4 on plantar flexion of feet bilaterally. He does have a strength of 5 on all other lower MSK strength tests. He does have bilateral sensory loss in his posterior calf and plantar aspect of his feet bilaterally. His Achilles reflex is a grade of 0. We can rule out quada equina as he does not have any incontinence and the weakness is not progressively getting worse. My working diagnosis for this patient is lower back pain with S1 radiculopathy. Assessment and plan will not be done for the purposes of this video. Thank you very much.